They're not giving you a hard time, they're having a hard time. I'm Debra, founder of Answers About Alzheimer's and Master Dementia Strategist. Today, we're going to talk about medications and why those with dementia refuse to take them. If you're joining us today, it means that you're having some tough days, and well, that sucks, and I'm pretty sure you'd much rather be somewhere else right now, but I'm glad you're here. These are tough days and rocky roads full of potholes, but here we are together, and we'll get through somehow. I will always be here for you every step of the way. Please do a nice thing for me and subscribe. It's that bright red button. If you do it right now, you won't lose me. I'll still be here. I'm working really hard to get an award from YouTube, but I need more subscribers. There are so many people just like you out there that need help, but they don't know about this channel. The more you subscribe and comment, YouTube loves that. And then YouTube will actually send these videos out to more and more families just like you who need the support. So help me to help others and subscribe and comment. I personally reply to every comment, and I'm going to start doing some thank you videos where I will be showing your comments and thanking you and naming you in the video. So comment, and who knows, you might just have your first name and comment on that thank you video. Man, that seemed like a lot. Anyway, all right, so let's dig in. Medications. Medications can be difficult even for the seasoned caregiver. Refusing to take meds is one of the top complaints of those caring for people with dementia. And I don't just mean family caregivers. I also hear this from professionals. So this can really put a wrench in your day. The dreaded medications. So I'll say it again. They're not giving you a hard time, they're having a hard time. When they refuse, the first thing you need to remember is that they're not just trying to be a jerk or giving you a hassle. They just don't get it. So you say to them, "Did you take your meds?" And they reply, "Yes." And you go and look, and there they are. They didn't take them. The first thing I must stress is don't ask them. This only puts them in a position of failure because they don't know if they did or not. But when you ask them, they don't want to be embarrassed and that they didn't know that they did or didn't take them or that they should have taken them. So they just say yes. So the first thing, never ask them if they took their meds. It makes them feel like they're being a 5-year-old asked if they brushed their teeth or washed their hands. It's not helpful. It's not proactive. It's belittling, and it will never promote self-esteem. So stop asking. Just walk over and get the pills and bring them over and say, "Here you go." If they pull the old, "I already took them" routine, don't snap back with, "No, you forgot. They're still in the box, see?" Take a step back and listen to what those words are saying. Telling them that they forgot implies that they are stupid and can't take care of themselves. So again, this is not helpful. It's not proactive, and it's not going to help your situation. Try using words that give them power. You got to think about this for a second. Something like, "You've been so busy lately, it must have just slipped your mind. Here you go." Or, "Yep, that happens to me sometimes too. No big deal. Here you are." Don't make a big deal out of it. And don't get sucked into an argument. If it's still not working, then forget it for a while and come back and try again later. When a person has dementia, they don't understand the purpose of things anymore. They might not even know what a pill is or that it has a purpose. So lower those expectations. It's hard for someone to do something that they don't understand. the purpose of medications is forgotten. Another thing that they don't believe is that they don't have any medical conditions. They're not sick. So why take pills that they don't need? If you try to insist that they need the medication for a health condition that they don't think they have, what do you think is going to happen? You know exactly what's going to happen. Yeah, a fight. Here comes the fight. Is that going to solve anything? No. It's time to get smart here. Start thinking, is what I'm saying to them going to make this situation better, worse, or stay the same? Because getting into a dialogue with them probably won't work. You can't convince. If your person gives you a hard time with meds, consider if they are taking more than 1 dose a day, do they have a hard time for all the doses, or do they maybe give you not such a hard time in the morning? If you find that 1 dose a day is less of a battle, ask the doctor about reducing the number of times per day that meds need to be given. Also ask about discontinuing any unnecessary medications. Find out if any can be omitted altogether. I mean, come on, let's consider what is the life expectancy and saving our relationships. Are all these meds really necessary? All right, so this next one kills me. I hear other trainers say, if the person has trouble swallowing, or you need to give them step-by-step instructions. Well, in my opinion, if their dementia is that advanced, they should be on very limited medications, and by this point, it should be considered to move to liquid or patches, or see if meds can be crushed and added to soft foods. Oh, here's another thing you could try. When they say, I don't want to take my pills, here's what you can do. You agree with them. Say, I don't like to take mine either, but it sure beats going to the hospital. Hey, let's take our pills together. Cheers, bottoms up. It's hard to argue with someone who agrees with you or is getting a little silly. Get your pills or your fake pills and take them together. Maybe avoid the words meds and pills and say vitamins or here's your beauty treatment and have a laugh. Another good approach that has a lot of success is figuring out who that person trusts the most or who they wouldn't want to disappoint. So let's say it's their best friend, Suzanne. You could say, Mom, Suzanne wants you to stay healthy so that you can enjoy her visit when she comes. You've got to use your imagination. You can do this. I hope you're liking this so far. Drop me a comment and let me know. I'm out here all by myself. Drop me a note and let me know. Okay, so another thing that will help them set up for success is to try to create an environment that is calm and quiet. If there's too much noise or stimulation going on around them, it makes any task more challenging. I cover this in detail in my certification course and during my one-on-one coaching sessions. If you're interested in learning more about that, or you need some personal coaching, just head over to my website, answeraboutalz.org, or go directly to my calendar at calendly.com/Debra Dementia and schedule your private session. And that link will also be down in the bottom of in the description. Okay, so here's a really big tip. People with dementia feel like they're losing control. And this is because they are losing control. And it sucks. So don't be bossy. And for God's sakes, sit down. If you're towering over them, you're intimidating them. That's not good. Get down on even ground. No one wants to look at your boobs or your stomach, right? Watch your body language and your facial expression. It says a lot about you. Don't come barreling in the house, rushing, grabbing the meds and pushing them in their face. Here, you forgot to take these. Wow. People with dementia are in a slower gear than the rest of us. You gotta bring it down a notch. We see the world like a moving motion picture, like a video. They see the world like photographs, still shots, and it's jumpy. So we've got to slow down in order to get the results that we want. So listen, if what you're doing isn't working, then reevaluate and try a different approach. And don't let the person with dementia suck you into an argument. I've said it before, and I'll say it again. You're smarter than dementia. And if you're not, then just keep watching my videos, and I guarantee you will be soon. I'm Debra Costu. Thanks for watching. I would love for you to comment and let me know where you need help, because that's what I'm here for. I'm here to help you. And there is a way that you can help me. You could comment and like and subscribe. And that tells YouTube that people want to see my videos, and you'll actually be helping others access more of this information. You too can have these amazing results, guaranteed. Join us in disrupting the memory care industry once and for all. To see if you qualify for our program, go to answersaboutalz.org and book an inquiry call.